is Guillermo. I work with clinical hypnosis, and I'm very comfortable talking about different types of topics. Today I want to give you an introduction of something that might be important, is what is hypnosis for clinically speaking. You can use hypnosis to be able to focus into something important. The most important part of what I want to talk to you about is that people, I can tell you what people come into my office for. They come into my office for different things that they cannot focus on or they cannot concentrate on. So what I do is that I work with different ways, naming, which I explain to you later, conversation predicates and different things that I would do in order for them to be able to focus on what they want. Some of the things that they do is to be able to think of many different things at the same time before they can focus on something important for them. So to a certain extent, the exercises that I do in the office is for the individual to be able to go back and concentrate on the things that they want to achieve that they have not been able to do because they're concentrating in something else that they think is going to be best for them. So in that way they can relax about doing something important, and also their muscles and their physiques are going to be relaxing much better, and it's going to be much better for them. This translates to emotions, to the way people think, because the way people think it's related to the way they speak, and what's important is more of what they think and not of what they speak, because that's the way it is. So one way or the other, for example, when you're talking about emotions, if someone cannot sleep because they have a bad emotion, or don't feel good because they have a bad emotion, or they cannot concentrate in something that is important for them because they have a bad emotion, one of the things that you could do is to change the way they think by certain exercises that I do in order to make them feel good about what they could do. Now, it's also fair to say that once a person feels better about what they're going to do, then you can convince them of doing something that they can do. In other words, if you talk to someone that feels awkward about doing something, and they think about that something that they're doing is awkward, then they won't be able to do it, or they won't be able to make it, because try convincing someone that feels bad about something, even though they know intellectually they want to do it. A good example with that will be a case I think that I mentioned to you before, in which a child, I work with a lot of families and children, and a child came over into my office with a bad emotion which translated into a bad pain in the stomach area, right here. Below the thorax, right here. So what happening there is that he's been going into see different physicians. He's been going to see different MDs, including specialists, that couldn't find anything that was related to the pain that he had. This child was 11 years old. Now, after I talked to him in many different ways, and I talked to his parents, of course. His parents were present with me in the office. What I did, mainly through hypnosis and through other exercises that I do, which I'll explain to you later, I made them concentrate more and focus more into what he really wanted to say, that he thought he couldn't say, or he tried saying in many different ways in different occasions. Mainly, for example, in school, which he wanted to talk to the teacher wouldn't listen to him because he was so private. He wanted to talk to the nurse when he felt the pain, but the nurse gave him a painkiller, a medication, because she specializes in healing the pain somatically, in other words, physically about that, but she would talk to him about the emotions. So this guy wouldn't be able to talk to anyone except for someone like me. So he came over to the office displaying what he has been thinking for the last 2 years, or 2.5 years, that they couldn't find about it. Subsequently, because of that, he was skipping school, he wasn't going to classes, and it was very detrimental for his parents. His mother and his father were in a as you can imagine, were in a very bad mood because they can figure out exactly what to do with him, and he couldn't figure out what to do with him. Now, with the context of what I'm speaking about, we're talking about now the social context of having a relationship being between a child and his parents. Find out later on that by speaking to me in the office and with his parents present, I found out that he wanted to be someone in life that his parents wouldn't understand. As a consequence of that, they were informing him or almost convincing him to be able to study more math and do more things that he didn't want to do. He didn't know how to say no to that because these are very good parents. This is a decent family. These are good parents. So what happens with that is that as a result of that, he emotionally felt limited about what he was doing because he really wanted to study arts. He wanted to go into maybe exercising his writing skills, using his imagination and creativity for other things that he couldn't say because he was feeling bad about not doing what his parents wanted him to do. So once he made the story, and every time I go into conversations with someone in the office, these are all stories. This is something that I will talk to you about later on. Every time I talk to someone, I recreate a story in my mind, which I change back in order to reflect to them exactly what they tell me, so they can understand it in a different way. And that in itself would change the emotion slowly but steady, because it's the constant ability to be able to interpret something different that will make them feel better about what they say or what they would do. So what happens with this child is that I change what I call locations. I change the spaces in which he was sitting to be able to make him feel good about changing locations, so then he can distract him from what he was feeling bad about. So I changed him from one location in the office to another location in the office, and I spoke with him as if his parents weren't present. In other words, by changing spaces, what I did was to take the parents into different places in the room in which he couldn't see them and they couldn't see him. So by doing so, he explained to me exactly what he was feeling, and he told me exactly what I told you before. He told me that he couldn't display to his parents, to his teacher, to his nurse, to everybody else, including his doctors, that he was feeling bad about what he was doing. As a consequence of that, he was so persistent in feeling bad about what he was doing that he made that feeling a necessity. He necessitated to be able to feel bad in order to make people understand that he was feeling bad. So he made a habit of feeling bad. And so he used that habit of feeling bad in order to address what he wanted, which in terms made everyone crazy because they couldn't find exactly what was his pain about. It turns out that he didn't have any other pain other than his emotions that he allocated in his stomach. You got it right here. So by exercising different things that I did with him, and by changing locations, and by speaking to him in different tones, and by readdressing the issues in many different ways, the pain started to go away by exercising his right to be able to take it away from his body. In other words, I distracted him from certain situations, I changed the stories, I made him not look at his parents, and so he started going back and regressing into something that was important for him, which was to be able to allocate the pain outside his body. And that's how I slowly and steady, I took the pain away from his body, and we found out in probably about 3 or 4 different sessions that he didn't have to have the pain. And because his parents were listening to what we were doing, they were a witness of what they could do differently that they weren't doing before. Which means that we recreated a scene which was like an act, sort of like a theater act inside an office, of the things that they could display, that they could do different, that would make the pain and the emotions disappear.